Good Saturday morning and welcome to the Health Wrap. Hi, Carla. How's it going? How are you?
Good, good morning, Carolyn. How are you doing?
I'm hanging in here, girl. This has been a rough week, but you know what? We got doctors on, so I
Yeah.
can use their advice and their help. But you have also been holding a sister up, and I thank you for that.
Oh,
I thank you for that.
you are welcome. And that's what we have to do, not only in this time, but all the time. I know, speaking of holding people up, one of the things that I noticed was an article in the New York Times, Carolyn, about how pediatricians are concerned about children. And they're worried about the children having all these Zoom meetings to do their schoolwork and the parents at home trying to teach and parents not having enough to eat. And so they're also talking about how the children are missing some of their shots right now. The American Academy of Pediatrics is very concerned about that. And also how to deal with emotional trauma, because a lot of times when kids are not at school or out around a lot of people, there are things that happen to them, and they're in the hands of maybe an abuser. So you also have children as young as 4 and 5 having anxiety attacks, and they're also concerned that kids need to be around other kids, that whole interaction, and then missing just getting hugs that kids like to get from their grandparents.
Absolutely. I just read a story this morning, just chilling. A 1-year-old infant that was thrown from a cliff allegedly by her father. And the mother, it sounds like there might have been some domestic violence going on. But here's an opportunity to do that public service announcement for your health. If you're watching and you're in a situation that you think is volatile, potentially abusive, please call and get help. Please get help. Just a tragic story. And we know everyone is stressed out. This is week what, 90 that we've been in quarantine. Okay, not 90, but we've been here a while, y'all. We've been here a
About
while.
7 or 8 weeks.
But we're trying to stay safe, and part of our commitment is to come to you. You know, I still have people saying, "Well, why are you doing this, Carolyn?" Because our commitment is to give you facts over fear, and to come to you not all day. I've said this repeatedly. This is not CNN, but Carla and I have just enough experience to be able to dig up some things that we think you ought to know and ought to pay attention to. And then your task or your homework is to then get off and then go look up additional information and find out what is the best thing for you to do or your family.
Absolutely. Well, we do have the doctors on call because this is Doctors on Call, and we're ready to start that conversation. And we want to welcome our doctors into the Health Wrap. And thank you again, too, out in the audience for joining. So today, and here are our doctor friends. We have Dr. Ron Means from Baltimore. He is a child and adult forensic psychiatrist and the chief medical officer for Catholic Charities of Baltimore. And we have all the way from Los Angeles, Dr. Ron Bailey, psychiatrist and an assistant dean at Charles R. Drew University of Medicine and Science. Thank you both for joining us today. Gentlemen, Carolyn and I were just talking about the
Hearing a little feedback. I know I threw my phone on the couch, so but if you maybe got your volume up, doctor's volume up on something, let's just try adjusting that. We'll make our way through it, but I want everyone to hear everything you guys have to say.
So thank you for joining us. Carolyn, I still hear it. Do you hear it a little
I
bit?
do. Yeah, I do it a little bit, but we'll try to mull
Okay.
our way.
Okay. Well, we have been talking about children and trauma and stress. And what we were talking about how they're not at school, they're not around people that can see what's going on with them all the time. They're also concerned about them not being able to get the immunizations, their shots right now because of going into the hospital, children not having food, their parents losing their job, and a lot of anxiety among the children. And we wanted to talk with you all, first of all, about how can we help children and families cope. Dr. Bailey?
Yeah, so I think that, first of all, thanks for having me. I enjoy the opportunity to work, I think, with Dr. Means here. I think clearly these educational activities are, I think, essential for all, but especially, I think, for our communities that historically very often have been disenfranchised, that have missed, I think, access to the best possible resources. So I appreciate your engagement in this, I think, in this educational activity. Let me just share, I think that a big issue for children is that, as we like to say, children are not only little people. You know, they listen to and they learn and they grow. Very often their thoughts about an issue evolves or changes over time. So we encourage parents and relatives and friends to hear your children, give them a safe space to talk about and think about and hear and share what their thoughts are. Corrective, use that term, I think, in a fair and I think a balanced way, which encourages more discussion bi-directionally for them to be educated, I think, in the right way. Very often misinformation is what all too often is disingenuous and problematic, I think, for children when there's any kind of a conflict or any kind of a disaster, if you will. This is a huge one because it's not likely to end tomorrow. There's really no already identified ending or finite time. This is likely to go on in some form or fashion over not just days to weeks, but weeks to months, if not longer. So we need to, I think, have an ongoing active discussion with our children, so that they can actually grow and understand without being so afraid that their anxiety is extremely high, but also being able to make the representative behavioral changes necessary, hand hygiene and protective measures, if you will, feel comfortable about them kind of going forward.
So I'm going to jump in here, I know we started out talking about children, but I can't help but think about some of the mothers that I'm hearing, and it's not popular to complain about being a mother, and I'm hearing some of them talking about the stress level, like they're having to be on 24 hours a day, 7 days a week. They're now kind of realizing that the school was helping out a little bit and giving them a break. But what advice do we have for the mothers?
Well, I think for parents in general, it's important to understand that this is a unique time and that the level of stress for everyone is extraordinarily high. We have to be aware of that. We have to make sure that we are reaching out and having contact with each other in order to make sure that we're constantly assessing how people are doing emotionally. I've been encouraging my own patients, and when I say my patients, not only the kids that I'm treating, but also the parents that come with those kids, to make sure that there is some sort of routine put in place. I know it's really hard in a time like this, and we want to just, curl up on the couch and watch TV all day and things like that. But for the kids as well as for the parents, it's important to have some sort of normalcy through a routine as much as possible. And that makes it a little bit more easy when you have to deal with the crisis in the immediate moment, the Zoom meeting that's not connecting for your child's teleeducation, or the fights between the siblings. When you have some example of structure during the course of your day, then it makes it a little bit more normal so that you're not feeling this constant chaos in the course of your life.
Dr. Means, you're not only a psychiatrist, but you're also somewhat of an investigator because you're a forensic psychiatrist as well. What are some of the signs that we should look for with families that they are about to break and they need help?
So I think, number one, not ignoring what we knew about families going into this isn't a key thing. I think that all too often we sweep under the rug when we know that there are issues with instability, substance use, domestic violence. Those are the things that we tend to ignore. And those are the things that are going to increase significantly during times like this. We knew that going into home isolation, that the likelihood of increased substance use, alcohol use, and domestic violence was going to be quite high. And we're seeing the signs of that now. So having that frequent contact with families, not being afraid to speak up, not being afraid to get others involved, including agencies involved, such as child welfare agencies, is critical. We want to make sure that we're protecting children. In order to do that, we have to protect families as much as possible, even parents who are struggling at this time.
What about resources? I'm just curious, because everyone is probably sitting at home and budgeting and rebudgeting and trying to count what's still in the account. But are there resources that can help families and individuals during times like this when you know that you're at wit's end? Dr. Bailey, I see you nodding.
Well, absolutely. I think that's one of our primary responsibilities is to link patients and families and communities with appropriate and accurate resource development. We both are psychiatrists. We speak very often about the American Psychiatric Association. I think at the macro level, everything from the World Health Organization, WHO, to the CDC have daily website updates and changes that I think are essential for some. I think within your own local community, I think there are psychiatric groups from NAMI and Mental Health Association that are really on board. And I think sharing daily updates and things that I think people can integrate into their lives. I love Dr. Means' comment about keeping your routine normative and effective. Essential, I think, not to lose routines that very often I think are regenerative. I mean, very often if we get together with our friends or family on Sunday to go to church or on Friday afternoon after work to enjoy some downtime, that kind of recharges your battery, so to speak, and refills your tank so you can kind of move forward, I think, on Monday. A lot of that is lost, even in the Zoom era. And I'm enjoying Zoom today so I can see all you guys. But the reality is losing a human contact and human interaction, I think, is much more harmful for many, especially those very often persons who may have already had some pre-existing difficulty that they were actually managing. So for us, I think knowing what the resources are, how to access them, I think are key. And what I've also liked is if you access one resource, it often links you, I think, to others. And you can find, I think, your way to what you really most importantly need for you and your family.
So what if something's going on? What if something's going on, you see it going on? How do you report it? Because some people are reluctant. I just don't want to get involved. But you see a child or a wife or a husband is in danger. What do we need to do?
So I think, as much as we tend to be reluctant and hesitant to get agencies involved, whether that be child welfare agencies or the authorities, we have to do so in times like this. We know that we can't make the interventions that we might typically do. We might drive over to someone's house. We might take the child for a while in order to give the parents a break. Those are things that we can't access right now, or we shouldn't be doing. So getting agencies involved, calling child welfare agencies, even getting the police involved might be necessary. And generally, at least child welfare agencies have an understanding that this is a time of high stress, and the likelihood of doing things like removing children hopefully should be the last resort versus giving resources and support to families in order to help them remain together and deal with their acute issues right now. I think that another important thing to understand is that although there's many things that the government has gotten wrong as part of this response to coronavirus, one of the things that's been done quite well is access to mental health care, access to healthcare in general, but in particular mental health care. So the capabilities to provide mental health care via telehealth, via Zoom, via whatever platform is being used by the medical professional or clinic is actually quite robust. So we should be having people access those avenues so that they can get help.
So if you ask someone or tell someone that you need the resource, you're assuring us that it certainly is out there, and there are professionals like you gentlemen standing by to assist, which is good to know. I see we've got a watcher that has a question, or I guess wants elaboration on routines being important. And one of the things we've also heard, in addition to staying safe, we've heard people say washing the hands, covering the mouth, but we've heard encouragements for exercise, and I imagine that also goes part into that routine as well.
It's a tremendous point. In fact, we have a conference call every Monday night, all the psychiatrists in Southern California, at least those are on the call, and we're discussing new strategies, I think, to encourage individuals, patients, families, and friends, I think, to look at this as a positive and to kind of move forward. As we just stated, I think correctly by Dr. Means, that the reality is the Zoom technology, if you will, is kind of new to so many of us. But the reality is it actually has some advantages as well. One is you don't have to kind of drive to the doctor's office. I mean, many argue in a big city like Los Angeles, other places, you may lose 2 hours by going and coming, trying to get there and park and kind of get in. So you may be saving some time. And one of my colleagues kind of pointed out that one thing that she's expressing to many of her patients and colleagues going forward is that's 2 hours, and should now we have time to exercise. Time to engage in activities that we actually have missed time to involved in the past, whether it's gardening or something that you do that's your hobby or what have you. So we should probably try to flip this, I think, in a positive way and find ways to, I think, strengthen people's resolve. What I also liked was that this idea that for us, very often patients have historically, sometimes because of stigma against mental health or mental illness, not wanting to go to the psychiatrist or the doctor in general, whether it's based on their ethnicity or their group or some, again, stigma concerns. Zoom kind of decreases some of that in some regards. Some persons now will pick up their cell phone, which they're actually very comfortable with, and you can actually see and communicate with your physician for a telemedicine or a telepsychiatry visit. I think these are some new strategies that are likely to continue post the COVID-19 immediate tragedy, and may actually provide some advantage for us in bringing better health care opportunities to patients that historically may have been marginalized in that regard in the past going forward.
I think that's great with a point that you made about taking all that time to have to get to where you need to have your care, because I know just having to get ready, take the time, be in the traffic, that makes me anxious more than sitting in the doctor's office, actually.
So I agree.
Yeah, it's interesting. We've actually seen in our clinics the show rates in terms of how many people are actually keeping their appointments. They've been much higher in large part because we're meeting people where they are. We're coming to their homes via these video systems. So there's certainly some downsides about it, but it's great to have that level of access. With every patient I see, I am asking them, what is the exercise that you're doing during the course of the day? And I'm in Baltimore, and I, treat a low-income population. So many don't have the flexibility to go out and go on a bike ride or run in their neighborhoods. So I then talk to them about what home exercise are you going to be doing? What YouTube video will you be watching that will do an exercise routine with you? Because it's so critical that we are getting exercise and trying to eat healthy, even while we're at home baking cookies and cakes and consuming them.
Okay, let's move on to de-escalating situations. Carolyn, you know the articles that we've seen this week and stories on television about a very sad situation that occurred in Flint at a Family Dollar store where the security guard that he had someone that he had told that they needed to wear a mask. And now he is no longer with us. He passed away. That some people in that family, not this family you're seeing here, that's his family, but some people that he were talking to at that family, the lady went home and some other family members, and they came back and they shot him and they killed him, unfortunately. And they
allegedly shot him.
Allegedly shot him. Thank you. And we do know now that headline said 2 or more. We do now know that they have now charged 4 people in this incident as of late yesterday evening. So now 4 people have been charged. And then we have Oklahoma, where the people were going back into stores and back into society, into retail. And they were so upset that the city's proclamation requiring face masks in stores and restaurants is amended after the threats of violence. So what the governor has gone now and said that we recommend instead of require, because there's been so much violence and threats against people. People are on edge, and what should we know as each week more people are returning back to reentering society? Dr. Means, what should we be looking for, and how should we position ourselves, because people are anxious?
You're absolutely right. Not only are people anxious because of coronavirus in itself, but they're also, have been sitting at home for such a long time. They have some pent up energy, some desire to get back to normalcy, even though it's being delayed by the length that this virus has been affecting us. It is true that everyone has been anxious, even when, I go to the store, you're in the grocery store, and you feel that anxiety surrounding you. We have to make sure that we are doing the things that we must in order to stay physically healthy. We have to continue socially distancing. When it's required, we should be wearing masks. We have to understand that this is for everyone's good, and use whatever coping strategies that we had pre-existing prior to this in a way to decrease our level of anxiety. So when you see others that you see are struggling, when their anxiety level is high, reaching out in some way in order to calm some of those fears, educate as much as possible so that people understand why these steps are necessary. And hopefully all that will help as we do progress to opening our doors and getting back to some sense of normalcy.
Dr. Bailey, I told Carolyn the other day I was in the grocery store, and in the store that I was in, they had these little blue squares that mark off the social distance. And I was waiting because the lady in front of me, she had children out, nobody had a mask on, and they were in my area, so I wouldn't move up. And so 2 cashiers came and said, "Is everything okay? Something wrong?" And I said, I'm trying to social distance. And the lady in front, when they told her, she got upset with the cashier. Everybody's trying to tell me to social distance, and I'm tired of this, and I'm going to get into a fight about it. What is going through our heads, and what do we say when people become a little combative?
Well, I think that this is certainly a remarkably germane issue for all of us because it certainly seems to strike at this nerve of what causes the anxiety and irritability that kind of pushes people over the edge. And I think a few things in play. You mentioned gun violence. My second book was on gun violence. We spent an entire time trying to figure out what is it about guns or gun violence that puts persons at such high degree of risk. Why would somebody, as in your early example, have a conflict verbally, go home, tell their relative, come back with a gun, re-engage in the conflict, and then kill the security guard? Well, reality I think is that persons very often feel insecure, powerless, lacking means in many ways. I think that the reality, as Dr. Means pointed out, very often if you feel that way and you struggle in one area, I think it easily carries over, I think, into a different area. And I think very often that's what we're going to see more likely in these settings until we can kind of get our hands around it. So something that may seemingly as simple as the governor saying that you must wear a mask seems power engaging for the governor and limiting for some individuals. And then they're there thinking and ruminating about it and very upset about it. And then when the security guard, who's in this regard the vector of the governor, engaging in the activity, saying you must put the mask on, then all of that venom and anger kind of comes out, and it's a conflict that very often did require de-escalation. Remarkably unfortunate that it didn't happen, and the young man lost his life. I think there are a few things we can kind of do about it. First and foremost, we believe in healthcare. Education is primary, and it's primary prevention. We should talk about it, think about it. People should, in many regards, begin to de-escalate in advance. The analogy would be the lady who stood in front of you with her children. When she goes to the store, goes out in public, she should recognize that, like you normally would with children, think that they may jump around or move around real fast and not be in the right place. And somebody may make a comment about social distancing or things of that nature. Like in old days, somebody make a comment about, well, your kid is, standing on my foot or touching my items, what have you. You wish that parent would be ready for that comment and not so quick to be feeling that they're being disenfranchised or insulted and needed to kind of strike back out and ensure that their space is properly protected. The other thing I think we should also do, I think that we should ensure that the authorities, in this regard, the cashier or the manager at the store, has some de-escalating techniques, and they've had some, if not training, certainly some education about how to manage it. This is a new type problem that we're likely to see. In the past, you go to a store, and as long as somebody didn't bump into you or grab your purse or kick you, you were fine. Now, if they stand within your bubble, within a 6-foot bubble, somebody might make a comment about it, and that may actually lead to some stress in someone who's remarkably already displaced about something else. So I think education and some degree of training is likely to, I think, be essential for us going forward. Those are tragic situations, not one that we'd like to see continue. I would finally say that you probably, Ms. Winfrey, did a good job when the person in front of you got angry by de-escalating, not saying anything, definitely not throwing more lighter fluid, so to speak, on a fire, and your situation ended amicably. Think about the other ones that very often one escalates and it leads to a problem at a higher level.
One of our viewers is pointing out that people often feel judged, and that probably goes for individuals as well, that people are calling them on the carpet as they're asking them to do it. I had a moment yesterday where I asked the young man who was the employee, I said, "Where's your face mask? Because I'm masked up and trying to get this taken care of." And he said, they don't give it to us, or we don't have it. They don't give it to us. And my response was, you can go on YouTube and figure out how to make one with a scarf. I really have to remind people, as we have said we're going to do, Karla, there is a level of personal responsibility that we have got to take in this fight against this virus. We've got to take it in this fight against health disparities. And the things you all are talking about, exercise, washing hands, those are things, and you can't wait for somebody to tell you to do it. You've got to get out here and do it. You can't wait for anybody to take care of you or your family.
Absolutely. One of the last things, Carolyn, I wanted to throw out there is the level of stress and isolation. And you and I were talking about some people are in isolation with their families, but that's not a good situation because they may be, let's say you live in the area where you have a small home and then people are in close quarters 24/7 in the event that makes it very stressful for some people who normally get along well. And then we have the other people who are singles and they're by themselves and they're isolated. And I was telling you that one of my friends in Atlanta told me one of her employees who was doing a great job. She had a drug addiction problem 3 or 4 years ago, got off drugs, was working well, was a top worker in the company. And because she always said, I have to work, I have to be doing something. And now that she's isolated, she's kind of disappeared and they're trying to find her. What do we say or do about people who already had mental challenges? This can be a scary time for them and for if they're isolated, and for people who have a big family and they're all packed there together at home.
Yeah, going into this, that was part of my largest concern because there are people that were struggling with mental illness prior to this, whether it be depression or severe anxiety, or even more severe illnesses like schizophrenia. I think that we have to encourage those people not to stop the things that were keeping them well prior, making sure that they're continuing to take medications, making sure that they're continuing to meet with their therapist via telehealth in order to do psychotherapy, doing all those things to ensure their stability. Certainly with substance use, making sure that people are staying in touch with their sponsors or continuing in their substance use treatment programs. I agree. I also worry about those who don't have the family around them, immediate vicinity or home. And then I worry about those who are packed together. I think that for those who are alone, we should all make it our duty and our effort to check on them regularly, to engage them more than others, keep them at the top of our mind. And for those of us who are struggling in homes and there's lots of family members around, I think that meeting together, discussing the realities of the situation, carving out personal space for one another, areas where we won't intrude on each other's time and space so that you can have some sense of privacy when you need it, or just some sense of escape, even if it's just in the corner of the room.
Well, we would like to thank our doctors, Carolyn, for joining us today. You've provided some very useful information for our viewers and tips that I know I'm definitely going to be using myself. So, Dr. Means, thank you. And Dr. Ron Bailey, thank you as well for joining us.
Stay safe.
It was a pleasure. You too.
Have a good day.
Good day, you too. So a lot was covered there in that segment with the doctors. I think some valuable information because people are having a tough time as we're seriously going into, I think this is week 9 for a lot of folks, different states and different times. And so again, we really hope that if you missed it the first time, you rewind and listen carefully to some of the good advice the doctors were giving.
All right, Carolyn. Well, you know what? This is the part of the show where we kind of talk about or celebrate things. And I know one of the things that I wanted to celebrate and commend is the Atlanta mayor, Mayor Keisha Lance Bottoms. And she has joined with the Walker Company brands. Actually, they joined with her. So this is what happened. So Mayor Keisha, she has a fund for beauticians, barbers, all type of cosmetology, nail techs, and she created it, Strength and Beauty, to be able to aid them because they've been shut down. And she's even added more to it. And when she did that, there's a company there in Atlanta called Walker and Company, and they are giving to that fund there in Atlanta to help the professionals. They're also giving money to Chicago high school students that have been affected by COVID-19 because they're doing distance learning and they need computers. So we want to shout out Mayor Keisha in Atlanta and the Walker brands.
I was going to say, she's one of the few mayors out here. You just have to say the first name. That's all you have to say, and everybody knows who
Yes.
talking about. Yes, congratulations to them in Atlanta. One of my favorites this week was a nurse that I actually caught on another broadcast, and the nurse was being commended. Her name is Sheena Williams. In Nurses Week, she was being recognized. But she was recognized because she had placed a video on Instagram. And you guys have got to see this because she said exactly what we've been saying now, Carla, for 8 weeks, just slightly differently. And if the message gets out, then we give it to them and take it to them where they are, as the doctors just told us.
The hospital for a stomach ache, I'm gonna need you to take a Pepto-Bismol and sit down. You know what I'm saying? Or, oh, I think I'm pregnant and you missed 4 periods. You are, sis, you are. You don't got to come and see us for that. You are more at risk by coming into the hospital than you would be at home. If your child got a runny nose, look, I promise you're gonna live. That is not the time to come to the hospital. You come to the hospital when your symptoms become unmanageable. Okay, that means that you have tried it all and this ain't gonna work, so you feel like you got to go to the hospital. You can call your primary. They also have hotlines where you can call the hospital and talk to nurses about your symptoms. But if one more of y'all come in for a headache, bow.
On a serious note, she's absolutely right. I mean, you heard the doctors in our pre-show conversation with them say that, one of the challenges is staffing, and you've got a staff that's on overload. I thank John Merriman for jumping in and talking about how informative it is. But staff members are on overload, y'all. So if you are not that sick, please don't bother them. But on the other hand, what we do have to caution, Carla, is there are people that do have conditions, pre-existing conditions. And what physicians don't want is for you not to maintain regular contact or care. I know, for instance, in my mother's case, I've been texting her doctor and raising issues as issues have come up. And so you want to stay in touch if you had pre-existing conditions. But those things you used to run to the ER for, they don't want to see you. And I don't think you want to be down there until we can get this virus contained.
And that's what both of my sister-in-laws, who happen to be nurses, Carlette, Natasha, happy Nurses Week. This is the National Nurses Week, so we want to commend and give a shout out to all the nurses. But my sister-in-laws were like, you can't take our mother-in-law to the doctor unless it's an emergency because it's too dangerous there, and they have to treat other people as well. So, and my mom's a nurse too, so I wish her happy National Nurses Week too, Judy Winfrey. And happy Mother's Day.